Hello everyone, this is my Improving Health Literacy, Fatigue, and Error presentation. To begin for this week, we learned that improving health literacy is important because it reduces preventable mistakes. As future healthcare administrators, promoting clear communication directly improves safety outcomes, and then it also supports equity in care. So, as administrators, it's our job to create systems that protect patients who may speak limited English or come from different cultural backgrounds. We also learned that health literacy is important because it improves efficiency and lowers costs. So, when patients understand their care, they follow instructions better, avoid unnecessary readmissions, and use emergency services less often. As for addressing fatigue and error, the importance fatigue is one of the biggest causes of medical errors. Nurses, physicians, techs, and administrators make more mistakes when working long hours, high workloads, or poor staffing ratios. In addition, it protects both patients and healthcare workers. It can also strengthens patient trust and improves outcomes, which means that safe systems can lead to fewer adverse events like wrong medication incidents, avoid miscommunication related harm, reduce hospital acquired conditions, improve adherence to treatment, and ensure patients understand their rights and decisions. Now, a case study on health literacy. Mr. Hang, who was a 55-year-old Cambodian man, was admitted through the emergency department with weight loss, jaundice, severe abdominal pain, and concern for pancreatic cancer. Mr. Hang and his wife only spoke Khmer, where they also understood a bit of English. The couple relied on their children to relay their medical information. However, neither child had fluency in their language, and the family stated that they don't need an interpreter since their children serve as their interpreters. While reviewing the electronic medical record, the admitting clinician noted that Mr. Hang had attended primary care several times in the last few months and no documentation or professional interpreter utilization was noted. Several appointments for labs and imaging had been requested but never completed. Then, based on labs and ultrasound findings, pancreatic cancer was confirmed. Mr. Hang's pain symptoms were controlled, however, his children were still their interpreters, and they didn't seem to understand the gravity of the situation. The clinician had difficulty evaluating their understanding of the likely diagnosis of what information had been relayed to Mr. Hang. Then, after some convincing, the family finally got a professional interpreter. So, an analysis of the case study and what we can learn. There's definitely ethical concerns in Mr. Hang's care, the first being using family as interpreters. Family members may purposely or inadvertently leave out information that's important between the patient and the physician or fail to comprehend the medical information provided by the medical staff. Additionally, family members have been observed to participate in discussions as a third party, expressing their own goals and worries rather than the patient's. So, if the family member is capable of making well informed judgments in the patient's best interests, these circumstances can justify decision making between the doctor and the family member. However, on the other hand, while making decisions, it becomes problematic if the family interpreter's health literacy and language skills are poor and patient preferences are not recognized. In situations like Mr. Hang's that needs preference sensitive decision making, the use of qualified interpreters can help overcome language, health literacy, and cultural hurdles. Healthcare staff should introduce professional interpreters as part of the care team, and interpreters can emphasize that confidentiality is a core component of their role. Now, as for a news story on fatigue and error, in December of 2017, while working at the Vanderbilt University Medical Center, Nurse Redonda Vaught was supposed to administer a sedative to a patient, Charlene Murphy, to prepare her for a brain scan. Instead, Vaught accidentally withdrew and administered Verunium, which is a powerful paralytic, from an electronic medication cabinet. The patient died shortly after, and the case became a flashpoint for national discussions on the pressures nurses face, including long hours, understaffing, and imperfect hospital protocols. Nursing advocacy groups highlighted how such conditions, which contribute to fatigue, increase the likelihood of errors. Now, the analysis on what we can learn from the news story. Fatigue is not an individual failure because I personally believe that these stories show that errors aren't because a nurse is careless, but rather because the workplace conditions, like long shifts, create an environment where mistakes become more likely. It's obvious as well that fatigue can slow reaction time, reduce attention to detail, and affect decision making. Furthermore, when a fatigued nurse is punished without examining the system, it creates fear and silence. Stories like these can teach us students that healthcare must prioritize a just culture where staff feel safe reporting fatigue, errors, and unsafe conditions. This story can also teach us the importance of double checking. A nurse can also communicate with other nurses, so there's two nurse verification. Nurses should also feel supported by their facilities because a tired nurse cannot safely care for others. We must also care for our nurses. And how can these stories inform and enhance risk management? Well, these stories reveal how small communication gaps can lead to big safety risk. We can help identify root causes, so like the staff relied on the family members to translate. It highlights patterns in vulnerable populations, can strengthen policy improvement and prevention strategies, and it improves staff awareness and accountability. And lastly, it can build stronger patient centered care systems. Thank you for listening, and this concludes my presentation. And then these are my references.